Your liver is one of the most important organs in your body. It helps you digest food, convert it to energy, store that energy for future use, and filter out toxins from your blood. But sometimes your liver can get damaged by various factors, such as viruses, alcohol, obesity, genetics, or autoimmune diseases. This can lead to liver disease, which is a term for a number of conditions that affect your liver function. Liver disease is a serious medical condition that requires urgent medical attention, so recognizing the symptoms early is important. Most liver diseases are easier to manage when detected early. However, some liver diseases may not cause many noticeable signs or symptoms until the damage is extensive. So in this video, we will talk about 13 early signs of liver disease that you should watch out for. These signs may vary depending on the type and cause of your liver disease, but they are common indicators that something is wrong with your liver. If you notice any of these signs, you should consult your doctor as soon as possible. Make sure you watch until the end to learn about all of them. Now let's get started. Number 1. Yellow skin and eyes, jaundice. One of the most obvious signs of liver disease is jaundice, which is a yellowing of the skin and the whites of the eyes. Jaundice occurs when your liver is unable to break down a substance called bilirubin, which is a byproduct of red blood cell breakdown. Bilirubin then builds up in your blood and tissues, giving them a yellow tint. Jaundice can be caused by various types of liver disease, such as hepatitis, cirrhosis, or bile duct blockage. It can also be a sign of other conditions, such as gallstones, pancreatitis, or hemolytic anemia. Number 2. Abdominal pain and swelling. Another sign of liver disease is pain and swelling in your upper right abdomen, where your liver is located. This can be caused by inflammation, infection, or fluid buildup in your liver or abdomen. The fluid buildup is called ascites, and it happens when your liver can't make enough blood proteins to keep fluid in your blood vessels. So, the fluid leaks out into your abdominal cavity, causing swelling and pressure. Abdominal pain and swelling can be mild or severe, depending on the extent of liver damage and fluid retention. Number 3. Loss of appetite. Loss of appetite means that you don't feel hungry or you have trouble eating enough food. This can happen because the liver may be producing less bile, which helps digest fats and makes food taste better. Without enough bile, food may seem bland or greasy and cause nausea or vomiting. Another reason this happens is that the liver may not regulate blood sugar well, which can affect your hunger and satiety signals. You may feel full quickly or not feel hungry at all. Number 4. Dark-colored urine. You probably know that urine is a waste product that your body produces when it filters your blood. The color of your urine can tell you a lot about your hydration level, your diet, and even your health conditions. Normally, urine is pale yellow or clear, depending on how much water you drink. But when the liver is damaged or diseased, bilirubin can build up and cause jaundice like Howdy explained, but it can also make urine darker because some of the excess bilirubin is filtered out by the kidneys and passes into the urine. Number 5. Nausea and vomiting. One of the most common signs of liver disease is feeling nauseous or vomiting frequently. This happens because your liver is not able to process the food you eat properly, and it can also affect your bile production and flow. Bile is a fluid that helps you digest fats and eliminate waste products from your body. When your bile is blocked or reduced, you may feel sick to your stomach and throw up. Vomiting blood can also be a sign of bleeding in your stomach or esophagus due to increased pressure in your veins, and vomiting bile can be a sign of bile duct obstruction due to inflammation or stones. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Fatigue. Another common symptom of liver disease is feeling tired all the time even after getting enough sleep. This happens because your liver is not able to produce enough energy for your body's needs, and it can also affect your blood sugar levels and hormones. When your liver is not functioning well, you may feel weak, sluggish, and unmotivated. Number 7. Sleepiness. Sleepiness is different from fatigue. It means feeling drowsy or sleepy during the day, even after getting enough sleep at night. This can be due to the accumulation of ammonia in your blood, which is a byproduct of protein breakdown that is normally detoxified by your liver. Ammonia can affect your nervous system and make you sleepy or lethargic. Number 8, easy bleeding. Another sign of liver disease is easy bleeding or bruising. This means bleeding or bruising more easily than normal or for no apparent reason. This happens because the liver is responsible for making clotting factors, which are proteins that help the blood to clot and stop bleeding. When the liver is damaged, it can't make enough clotting factors, which leads to bleeding problems. Easy bleeding or bruising can also be caused by other conditions, such as vitamin K deficiency, hemophilia, which is a genetic disorder that affects clotting, or leukemia, which is a type of blood cancer. Number 9. Disorientation or confusion. One of the more serious signs of liver disease is disorientation or confusion. This means having trouble thinking clearly, remembering things, or staying focused. This happens because the liver is unable to filter toxins from the blood, which can affect the brain and cause a condition called hepatic encephalopathy. This condition can cause symptoms such as mood changes, personality changes, anxiety, depression, hallucinations, delusions, or coma. Number 10. Tremors. Tremors are involuntary shaking movements of the hands, arms, legs, or other parts of the body. Tremors can be caused by many factors, such as stress, caffeine, medication side effects, or neurological disorders, such as Parkinson's disease or essential tremor. But they can also be a sign of liver disease, especially if they are accompanied by other symptoms, such as jaundice or ascites, fluid buildup in the abdomen. Number 11. Breath may have a musty or sweet odor. Another sign of hepatic encephalopathy is fetor hepaticus, which is when your breath has a musty or sweet odor due to the presence of volatile substances that are not metabolized by your liver. These substances can include ketones, which are produced when your body breaks down fat for energy, mercaptans, which are sulfur-containing compounds, or dimethyl sulfide, which is produced by bacteria in your gut. Number 12. Swelling in the legs and ankles. Another sign of fluid retention due to liver disease is swelling in the legs and ankles, also called edema. This happens when your liver is unable to produce enough albumin, a protein that helps maintain fluid balance in your body. As a result, fluid leaks from your blood vessels into your tissues, causing them to swell. The swelling can be worsened by standing or sitting for long periods of time or by eating too much salt, and it can be very uncomfortable and limit your mobility. Number 13. Itchy skin. Another symptom that can indicate liver disease is itchy skin that can affect any part of your body, but it may be more noticeable on your palms and soles. This can be caused by bile salts accumulating in your skin due to reduced bile flow from your liver. Bile salts are chemicals that help digest fats in your intestines. When they build up in your skin, they irritate your nerve endings and cause itching. So, these are some of the early signs of liver disease that you should be aware of. If you notice any of these symptoms, you should see your doctor as soon as possible. Liver disease can be life-threatening, but it can sometimes be reversed with treatment or a liver transplant. The sooner you get diagnosed and treated, the better your chances of recovery. Now, what do you think? Did you have some of these symptoms before? Was it actually liver disease? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.